Environmental hazards threaten us all while having a disproportionate effect on the health of Black and Brown communities. For example, people living in Dorchester and Roxbury have greater exposure to air pollution from traffic and industrial sources, and adults in those neighborhoods have higher rates of asthma than anywhere else in Boston. But how did it get that way?
We know that a history of housing discrimination through policies such as redlining affect where Black and Brown people can live, whether they have access to fresh food, and whether their electricity stays on.
Families are making a decision. Are they going to pay rent? Are they going to pay utilities? Are they going to eat? It's not a simple thing to choose, right?
These factors, social determinants of health, are intrinsically linked to the physical health of these communities.
Ironically, health systems themselves are a major source of environmental hazards.
For example, some of the single-use items that we have in the hospital, which contribute to improvement in infection control, can be more cost-effective, but at the same time contribute a lot more to environmental change and carbon emissions.
By investing in sustainability, however, the healthcare industry can unlock solutions to all of these problems. Sustainability is healthcare. By building sustainable practices and programs, we can address root causes of poor health and work towards environmental justice goals.
Serious medical conditions may have many causes, but the role of environmental factors such as air quality cannot be ignored.
One of the major pathways that's related both to pollution and climate change is particulate matter that comes from burning fossil fuels, particularly diesel. They get breathed into the lungs and the smallest ones enter the bloodstream. And those can cause damage to the internal parts of the blood vessel.
When conditions like heart disease, diabetes, COPD, and asthma lead to repeat ER visits and prolonged inpatient stays, not only do those patients suffer, but our healthcare system struggles to deliver efficient and cost-effective care for all patients.
Working to address environmental justice can decrease the need for that care, which not only improves patients' physical health, it also improves our institution's financial health. At BMC, we have a long history of launching sustainable initiatives to address patient needs while also strengthening our infrastructure and our balance sheet to ensure that we can fulfill our mission for years to come.
Our cogeneration plant reduces the cost of energy at the hospital by at least $1 million per year. Meanwhile, our Brockton Behavioral Health Center is the first net zero building of its kind in the US. Its geothermal heating and cooling systems and 700 kilowatts of solar means we're able to save up to $200,000 per year.
BMC is the first nonprofit healthcare organization in the country to issue sustainability bonds, which generated $232 million to renovate and expand our campus. These improvements will increase patient access to care through added beds and OR space, while keeping BMC on the path to becoming carbon net zero by 2030.
Other programs in our portfolio benefit patients even more directly by addressing food and energy insecurity.
Every year, over 5,000 pounds of fresh, local produce is harvested from our rooftop farms to feed patients and support community programs, all while reducing our carbon footprint and increasing green space.
Our Clean Power Prescription Program is a first-in-the-nation pilot that reduces the cost of utility bills for patients facing energy insecurity. We do this by applying energy credits from our solar panels to their accounts, which helps them keep their lights and their electronic medical devices turned on.
When I'm able to help them, it feels good. I feel like I'm making a difference. When I'm able to get something done and patients are not looking at us as every other entity who's trying to take advantage of them or not help them, it feels good.
Over a 20-year period, the total savings from energy efficiency on our hospital campus equates to $3 billion, which we're able to redirect to our mission of world-class, equitable care for all. And our accomplishments have earned national recognition.
As a healthcare organization, we feel obligated to share the knowledge that led to those successes. To accomplish that, BMC Health System has partnered with Omicello to launch Oakwell, a new company that offers sustainability management and real estate optimization services so that other healthcare systems can reduce carbon emissions and improve efficiency, leading to a healthier environment and more affordable healthcare.
We are at a pivotal moment clinically, financially, and existentially. By prioritizing sustainability, healthcare systems can drive meaningful change and ensure a healthier future for all.